All right, let's get right into it. Today, we're giving the EU's big medical device laws, the MDR and IVDR, a full regulatory checkup. They were meant to make everything safer for all of us, which is great. But the big question now is the system itself actually healthy? And yeah, that's really the million-dollar question we're tackling. Since these rules rolled out, we've heard a lot from just about everyone involved. So are they working as planned? Or are we seeing some, let's say, unexpected side effects that we really need to get into? So here's the game plan for our checkup. First, we'll diagnose the problem. What's actually going on? Then, we'll check the vitals, things like efficiency, innovation, and the supply chain. After that, we'll look at the bigger picture, the whole digital and global scene. And finally, we'll wrap up with the bottom line. What's the cost and what's the outlook?
Okay, first things first, the diagnosis. Why are we even doing this checkup? What are the symptoms that got us here? Let's dig into the evidence.
So here's the heart of the matter. These rules came about for a really good reason, right? To boost safety and transparency after some pretty major scandals. But, and it's a big but, in the real world, everyone from tiny startups to massive hospitals is saying they're running into huge problems. The intention was solid, but the rollout? It's been tough.
And look, this isn't just people complaining. This is hard data. The European Commission asked for feedback and got almost 400 responses specifically flagging that it's getting harder to find certain medical devices. That is a huge red flag, a symptom that hits patients where it counts.
Wow. And this right here, this shows a massive trust problem. More than half, 55%, of the people involved flat out disagree that these rules are building trust. Only about 20% think they are. I mean, when the folks working inside the system don't trust it, you've definitely got a serious issue on your hands.
So what you have to realize is these aren't just one-off problems. It's a whole pattern of pain points. We're talking about a mountain of paperwork that's just crushing smaller companies. We're seeing huge delays because the notified bodies, the groups that give the green light, are swamped. You've got different countries playing by slightly different rules. The big central database, EUDAMID, still isn't fully up and running. And on top of all that, there's a very real fear that devices for rare diseases might just disappear.
Okay, so all those pain points, they really jam up the gears of the whole system, which brings us to our next point. Let's take a closer look at the process itself. Is this thing running smoothly, or is it just stuck?
Get this. To get a new device certified and into a hospital, it's now taking between 13 and 24 months. Think about that. That's potentially 2 years. In a field like medtech where things change in a blink, 2 years is an absolute eternity. That's a huge delay for getting life-saving tech to the people who need it most.
So what's causing all these delays? Well, this chart is pretty revealing. It turns out that more than half of all rejections are for a reason that's kind of shocking. The company sent their application to the wrong place, to a notified body that isn't even approved to look at their kind of device. It's wild. Then you've got another chunk that are just incomplete. These are basic mistakes, but they're gumming up the whole works. And that leads us to a really simple but crucial pro tip for anyone out there trying to get a device approved. Before you do anything else, before you spend a single dollar or a single hour on that application, just double check, triple check that the notified body you're sending it to is actually allowed to review your device. I know it sounds so simple, but the numbers don't lie. It's the #1 reason for rejection. All right, all these delays and hurdles, they lead to a really, really big question about innovation. Is this whole system helping to create the next big thing in medicine, or is it actually stopping it in its tracks?
And the numbers on this are, well, they're pretty sobering. One industry group found that the EU is just not the go-to place to launch new tech anymore. For the big guys, its appeal has dropped by a massive 40%. Even for the smaller, quicker companies, it's down 12%. What does that mean? It means innovators are taking their best new ideas somewhere else first.
So let's put ourselves in the shoes of a startup, right? What's their playbook for survival in this environment? Step 1, just brace yourself for high costs, for tons of paperwork. Step 2, get ready for a grilling. Your clinical evidence has to be rock solid, especially if you've got something brand new. Step 3, use the resources you have. There are new expert panels that can give you scientific advice, especially for those special breakthrough or orphan devices. And step 4, probably the most important, plan for the worst. That 13 to 24-month delay, you have to build that right into your timeline, right into your budget. And all of this, the delays, the costs, the complexity, it all boils down to one critical real-world question. What about the supply chain? Can doctors and patients actually get the devices they need when they need them? This number should really make you stop and think. Nearly half of doctors in one survey said, yes, we are having trouble getting the devices we need. And we're not just talking about bandages and basic equipment. This is hitting super specialized areas like heart surgery for children, where you can't just grab a different tool off the shelf. For some of these kids, there is no alternative. And the message from everyone is crystal clear. This quote is from the Commission's own report. Everyone is saying the same thing. We have to streamline this, we have to simplify it. There's a real consensus that if we don't, we risk losing these specialized devices altogether. Okay, let's pull back for a second and look at the big picture. Because medtech isn't an island, right? It's all connected to this huge digital and global web. So where do these EU rules fit in all of that? I mean, just look at this thing. It's a lot. The medical device rules are just one part of this giant puzzle. If you're a manufacturer, you're also dealing with the new AI Act, chemical rules, cybersecurity laws, data privacy, the list goes on and on. It's a tangled web, and trying to comply with all of it is a monumental task. And what's interesting is you see two totally different ways of thinking about this on the global stage. On one hand, you have the EU, which is building this massive, all-encompassing system from the ground up. With its EUDAMED database set to be required in 2026. Then you have a country like Mexico, which is taking a totally different path. They're saying, hey, if another trusted regulator already approved this device, we'll give you an answer in 30 days. It's all about speed and collaboration versus building a perfect but slower internal system. Okay, so our regulatory checkup is pretty much complete. Now it's time for the final part of any doctor's visit, the bottom line. What's the damage, financially speaking, and what's the overall prognosis? Let's talk numbers, because they matter. And this isn't just hitting the companies that make the devices. Think about the distributors, the ones who actually get the tech to the hospitals. For them, it's costing, on average, almost 33,500 euros every single year just to comply. And you can bet that cost doesn't just disappear. It gets passed on. So what's our final diagnosis here? Let's break it down. 1. The system is under a lot of strain. The costs and the red tape are real. 2. Patient safety is and always should be the #1 goal. But the way we're trying to achieve it is just not efficient. 3. Literally everyone is screaming for things to be simpler and more streamlined. And 4. Those big promises of more trust and transparency, we're just not there yet. So yeah, the diagnosis is complicated. You've got good intentions on one side and some really serious side effects on the other. Now, the European Commission knows this, and they're already talking about changes to fix things. But that leaves us with one last lingering question. Are these proposed fixes the breakthrough cure we need, or are they just a placebo for a system that might need much more invasive surgery?